because of problem.
Yes, sir, I know it because
I had to join here.
Sir, because
Rabindranath Pal is my student, and I know very much. I remember you, Muni sir.
sir, I know because Babuni was not problem. Sir, now yes, you are superintendent, sir. And even if you belong to Department of Economics, we have very much contact, close contact with you, sir. Because by that time, university was like that. And the son of Professor Vivekananda Das was my close friend, Babuni, sir, Babuni. So, several times I visited the department. I know from the beginning a few members in the Department of Economics, but you are one of the most sincere professors, sir. By that time, I know you also. And you are always coming to department, always sharing some books and materials, sir. I know it, sir. So you are very happy. And particularly my Department of Economics of our college is very lucky to have you as one of the delegates, one of the resource persons. So your help, your deliberation definitely will help us, sir, in going ahead. So once again, I welcome you, sir, to this webinar. Thank you, sir.
Thank you.
Now, I
Pradhan sir, namaskar. Myself, Dr. Rabindranath Pradhan.
Rabindra, I remember.
Sir, now I request our one of my department colleague, Amas Pakamachi, to please briefly introduce Professor Pradhan sir on this webinar. Pakamachi sir.
Thank you, sir, for your giving me this opportunity to introduce our special guest of honor, Professor N.B.Pradhan sir. I am Amas Pakamachi, lecturer in economics from KSUB College. Esteemed my teachers and participants of this webinar, good afternoon to one and all. Today we are pleased to welcome Professor N.B.Pradhan sir. Professor N.B.Pradhan is the guest of honor for today's webinar. He is a retired professor of economics at BERHAMPUR University. Before that, he has served in Saraikela College, Ranchi University, Tikot College, BERHAMPUR University, and Revensa College under Revensa University. He has received his PhD degree from BERHAMPUR University. His area of specialization includes mathematical economics and econometrics. He has supervised 12 PhD scholars, 2 delegates, and 35 MPhil scholars. He has published 70 research papers in different national and international journals. He conducted a Government of India sponsored research project on evolution of DPAP in Fulbani and in Kalahandi district, SFDA in GANJAM district, and ERRP in Fulbani district. He was director of the project Dynamics of Tribal Exploitation and Growth of Naxalite Movement in Andhra Pradesh, Chhattisgarh, and Odisha border regions. He was president of Odisha Economic Association in the year 2005. With this brief introduction, I would like to request our guest of honor, Dr. N.B.Pradhan sir, to deliver his lecture about the situation of Odisha during COVID-19. Now, over to you, sir. Thank you very much. Namaste.
Should I speak?
Yes, sir. Yes, sir.
Esteemed President, Dr. Nirajana Muni, Principal KSUB College, Bhanjanagar. Esteemed Convener, Dr. Rabindranath Pal of KSUB College, Bhanjanagar. My dear co-convener, Dr. Prakumar Padi, Director IPREMS, BERHAMPUR, Mr. Pottamaji, Mr. Vijay Kumar Malik, and Ms. Anita Mahapatra. Distinguished participants, Dr. Amendra Das, Associate Professor Niger, Bhubaneswar, Dr.Priyabrata Sahu, Assistant Professor BHU, Varanasi. At the outset, I would like to express my deep sense of gratitude to the organizers for providing me this opportunity to present myself in this seminar. And I am especially, uh, I especially remember Dr. Praveen Kumar Padi. With his initiative, I was bound to come here. Otherwise, I was reluctant in the beginning to participate in webinar because this is new kind of things for persons, old persons like us. Anyway, I am here to present the situation of COVID-19 in Odisha. I will not go to economic part of it because economic part, the fiscal policy and other parts, has already been taken up by Amarendra Das. And Priyabrata Sahu will focus on the management aspects and other aspects. I will show you how the COVID situation took part and affected different parts of Odisha. Let me begin with this. Just I will give you an overview of COVID-19. This disease was first identified in late December 2019 in Wuhan city of China, which thereafter rampantly spread across the world, affecting 217 countries. Subsequently, when there were only 26 confirmed cases of COVID-19 in India on 15th March 2020, the first case of COVID-19 was detected in Odisha on 16th March 2020. A 31-year-old man from Bhubaneswar who had returned from Italy became the first victim of COVID-19 in the state of Odisha. A 72-year-old man from Bhubaneswar died on 6th April, tested positive on 7th April, by the first death case in the state. Now, just see, till today, Odisha has 3,13,096 total positive cases with 7,360 active cases with 3,04,908 recoveries and 1,640 deaths, whereas in India it is more than 90 lakhs. Now coming to the COVID situation, what we find at first, Odisha was brought from. Now let us see highlight the pictures how it first spread in Bhubaneswar. Bhubaneswar, it was brought from abroad. Many persons came to Bhubaneswar by flight, and therefore it spreads in Bhubaneswar, and Bhubaneswar became the hotspots of COVID cases in Odisha, and Bhubaneswar started shutdown, lockdown, containment zones, like that. So situation was much more serious in Bhubaneswar. By that time, Ganjam was in green zone. Now, in the meantime, the main cause of spread of COVID became due to influx of migrant laborers. What we see, by migrant laborers started returning to Odisha from Gujarat, Ahmedabad and Surat, Delhi, Mumbai, Kolkata, Chennai. So first when laborers from Kolkata came by road. So there was a spread of COVID in Jajpur, Bhadrak, then your Baleswar, and that didn't affected due to local contact to district of Kendrapada and your Cuttack. Later on, it so happened that many laborers from Surat, Ahmedabad returned to Ganjam. So what we see, one thing, let me give you the figure here. Just see that 31st August. By 31st August, Ganjam was the highest affected area with 21,000 with 21,000. Ganjam was the first affected area with 21,000 and Kotak Khorda was the Ganjam was the first with 18,000. Sorry, Ganjam was the first with 18,000 affected areas. Then Bhubaneswar was second, Kotak was third. But now see the situation. Khorda has the highest figure of 51,799. Kotak 27,478. Ganjam 21,575. So Ganjam occupies the third place. Why during August, by the 31st August, it was the highest case? Because out of 256 Shramik trains, 200 came to Jagannathpur railway station. 1,000 buses came to different parts of Ganjam by road. And many persons from Chennai and other places came by boat. So it was because initially because of plight of the returning laborers, migrant laborers, there was a spread of COVID situation. And later on, there was local spread. In Bhubaneswar, particularly slum areas, BERHAMPUR, different slum areas. But let us see how the government of Odisha and district administration, especially the district administration in Ganjam, control the situation. Our chief minister gave the power of collector to sarpanch. So these centers, many centers were opened in different panchayats who provided quarantine centers to migrant laborers. Testing was done. Then they were admitted to different hospitals. Hospital facilities were increased by the government of India in different parts of Odisha. And thus, now we see that trend is declining. There is declining trend. Once it happened that per day affected cases were more than 4,000. Now it is 700 something. But one peculiar thing we find in the state that number of death remains constant. Say 16, 17, 18, 16, 17, 15 like that. In spite of that, we find that this number of deaths compared to Delhi, Maharashtra and other states is very low. Therefore, we are happy that our government could tackle the situation in a right manner by spending a lot. I am not coming to economic part of that, but the amount of expenditure which is needed is very high on maintenance of hospitals, testing, then expenditure of 14 days quarantine time of different persons in different centers. So expenditure is very high. By giving some salaries to Asha Karmis, Anganwadi Didi, then special doctors. But in spite of that, we see the sad situations that many have sacrificed their lives who are known as Corona Jotha, say Sarpanch, especially many Sarpanch of Ganjam, then journalists, two journalists of Hinjidikatu, then many doctors were affected. They became victim of this COVID. But in spite of that, they continue to help the patients, and now we find that situation is under control and it is declining. Today's, some days ago, Ganjam had only 7 cases. Today now it is 18, compared to 64 or 61 something for that. So therefore, Ganjam has been considered as a model to control COVID. World level, Ganjam is praised. Ganjam model is praised. How it could control the COVID situation. In Odisha, Chief Minister, we must admire that Chief Minister N.B.Pradhan, who liberally gave help to different persons in Odisha, in different districts, by providing hospitals, facilities, and now to rehabilitate laborers. One problem is the rehabilitation of laborers. Let us see how, in especially Ganjam, there are skilled laborers, say textile mills of Surat, then diamond polishing. They are mostly engaged in skilled workers in textile mills and diamond polishing at Surat. Perhaps many of them had already returned to that. But now problem is how to provide the mandate or employment to the persons who have returned here and who are not willing to go back. But certainly some persons will go back. But those who are here, we government, and we must think how to provide them employment. So this is, economic crisis is there. Yes, person Amarendra Das, I remember that Odisha government had surplus revenue. It is not that. Government is facing crisis because of heavy expenditure in other case. So government is compelled to cut down some expenditures. But there may be something political, but definitely government is facing crisis because of decrease in revenue and increase in expenditure. But one thing we must see, that government should spend the amount which they have efficiently, and I hope that we can control this COVID situation very soon.
Sir Pradhan sir, kindly please certain because another resource person is there. Please sir.
Okay. I complete here. Thank you.
Sir, thank you for your presentation, sir. Sir, actually, in the beginning when you told that I am not, I was not interested, but Robin actually insisted me, sir.
Really,
and sir, your presentation is very nice. And though you have not given any economical aspect, but you have given your views on the descriptive part of, and particularly Ganjam district and the government of Odisha and how they have taken the interest to control this situation. Thank you for your presentation, sir. Now, sir.
Praised by everybody.
Okay, sir. Thank you, sir. We are in Ganjam, so that is why you have nicely presented and compared the situation with Ganjam.
At world level, Ganjam model is praised.
Okay, sir. Time is running short, so just I am requesting to my colleague Anita. I am now requesting to Anita Mahapatra, my colleague, to introduce our resource person, Professor Priyabrata Sahu. Please, Anita.
Thank you, Dr. Ravi Sahu. Good afternoon, everyone. Thank you for being here. It is my pleasure to welcome Dr. Priyabrata Sahu from Banaras Hindu University. Dr. Sahu is an assistant professor of economics in Banaras Hindu University, and his area of interest lies in labor economics, development economics, poverty, inequality, and regional disparities. He has published so many works on different economic problems of Odisha. He received the Best Paper Prize for the paper entitled Is Growth Proper in Andhra Pradesh and Telangana in the Development Convention 2018 in Isaac, Bangalore by Springer. Now he is going to share his views on COVID-19 and livelihood vulnerability, livelihood of the migrant workers in particular. Now I will request everyone to pay full attention to Dr. Sahu, and I will request Dr. Sahu to deliver his talk. So, Dr. Priyabrata Sahu.
Yeah, good afternoon, one and all. Thank you, Anita, for your nice word. Let me take this opportunity to thank the organizing team, especially Anita, to invite me to BHANJANAGAR. Basically, I worked there for 2 weeks in the Women's College as a lecturer. So it's kind of coming back to BHANJANAGAR. It's a nice place. I enjoyed my stay also there for 15 days. Okay. The esteemed guest of honor, Professor Pradhan, the president of the webinar, the principal of KSUB College, the convener, Ravindranath Padu, Praveen Kumar Pal, the director, IPREMS, BERHAMPUR, the co-convener Anita, Bijay and Amas. It's really a pleasure to be back to BHANJANAGAR and to be with all of you. So what my co-presenter already has presented the macro pictures of Odisha as well as the fiscal situation of Odisha. So I will not go to that part. What I'll do basically is that I'll talk about the migrant and then the COVID and I'll present. I'm having I'll divide my presentation into 3 different parts. Let me share my PPT and then okay. So this is basically the broad title of my presentation. So this is COVID-19 and the plights of the migrants in Odisha and the way forward. So what I'll do here is that I'll divide my presentation into 3 different heads. What I'll do, I'll just give certain trends on the COVID-19 in Odisha as well as in India. And then the next part, I will move to the employment, poverty, and migration trends, and the reverse migration part as well in case of Odisha. Then in the last part, I will move to the state responses and then the way forward. So if you look into the disaster management in case of Odisha, the state has been proactive since long. Okay, whether it's in case of filing, whether it's any kind of disaster management, the Odisha government is very proactive, and it has been in the international news for that. Okay. So you might have heard about in the microeconomics the concept of risk and uncertainty. Okay. So if you the decision making of whether it's any kind of individual economic agent or it's a the state the decision making will be too easier if the risk is already to be known to everybody. But if the risk is unknown, if it is uncertain, then it's very difficult to do any kind of management or any kind of decisions. The COVID-19, if you see, the pandemic is uncertain in nature. So that's why the management part is too much difficult. The COVID pandemic not only creates the health hazard for most of us, it also creates affect the lives of crores of people and as well as the livelihoods of the masses. It will affect not only different sections of the society, it also affect different sector. You can say the tourism sector, you can say the aviation sector, you can say the transport sector. So all those, whether it's primary sector, secondary sector, tertiary sector, different kinds of sectors has been worstly hit by the pandemic. The worst hit sections of the society, we can say, is the migrant one. And there are large number of newspaper piece which has been brought, and no such article has been brought yet as such. Okay, on that part. Okay. So this is not a part of my research as such. So what I have, I thought I will present something on the COVID, and then Anita has requested. I thought I will just. I have collected certain data from different COVID portal, and then collected certain materials from different articles, and then so I've been presenting those part one. So if you look into the COVID trends of Odisha and as well as India, so this is the picture. So you can see that the number of confirmed cases as of yesterday was 3,13,323, which is around 3.48% of the India cases. And if you see the number of active cases is around 7,000, it's around 6,737, which is around 1.52% of the India cases. These two figures basically shows that the Odisha has managed the COVID situation properly. Okay, showing that 1.52% number of active or the positive cases is showing 1.52, rather the number of confirmed cases is showing 3.48. Okay, so it's showing that the Odisha government has proactively done the management or the governance part of the COVID situation. Also, you can have a look into the recovered rate and as well as the disease, the number of deaths. Okay, as of the yesterday. So if you look into the number of states which are having the highest number of confirmed cases, okay, you will find that Odisha is the state which are having is the 9th states which are having the highest number of positive confirmed cases. Before that, it's the Maharashtra which are having highest cases, followed by Karnataka, Andhra Pradesh, Tamil Nadu, Kerala, Uttar Pradesh, Delhi, and West Bengal. So these are the different kinds, different confirmed cases, active cases, the recovered rate, the deceased one, and then the number of tested cases. Okay. This is the trends of confirmed cases. If you look into this particular trend, as of yesterday, there are around 90 lakhs, okay, 95,000 cases, 96,000 cases. So if you see this graph, you will have a kind of, you will see that it's a kind of constant movement from 1st February up to 1st July. Okay, from 1st July up to mid of September, you will find a convex kind of set. Okay. And then from the mid of September to up to now, you find a convex kind of set. But so I can, you can refer in mathematics, you might have done the convex and concave set. It's basically showing that it's the number of confirmed cases during that period, like 1st August to mid of September, it increases at a very faster rate. And then after the mid of September, it has increases but at a diminishing rate. So this is basically the number of cases of COVID or the confirmed cases. If you look into the number of active cases, the number of active cases, though it has been increases, from the mid of September it has been decreases in case of India. And number of recovered cases has been increases throughout, and it's a good sign for all of us. So if you see the number of cases deceased, okay, the number of tested cases. Okay, so you'll find that the number of testing which has been done has been throughout has been rising from 1st August. Okay, so this is then we'll move to the trends of Odisha. So as of yesterday, the Odisha is having around 3,13,323 confirmed cases. And if you see the graphs of confirmed cases of Odisha and as well as India, both have been showing you the same kind of graph. It's a kind of convex set, and then it's been moving from the maybe the middle of September. It's converting to the concave one, which shows that it increases at a very faster rate up to the October, the last of September, and then after that it has been increases at an increasing rate. So this is again the number of active cases, which has shows that it increases up to the last of September, end of September, and then it has been fallen down. And the number of recovery, it has been increases again, though it increases at a faster rate at the initial point of time, then it has been slowed down in case of Odisha. It might be due to the low testing, which might have done in the later part. Okay. Then this is the number of testing. Okay. So if you move to the district-wise analysis, so you'll find that the 16th March, there are only 2 cases, and that's to the district of Khurda. But after that, if you look into the 29th April figures, they will find that Khurda is having around 47 cases, and then followed by Jashpur, Baleshwar, Bhadrak, and then Sundargarh. So in that picture, Ganjam is no more. It's having hardly maybe 1 cases during that point of time on 29th April. And then if we move to the 25th May, that is the point of time when the second lockdown has already been happened, and the migrants who have been moving from the Gujarat, Surat, and then some part of Tamil Nadu, and then the Telangana to different parts of Odisha. So we'll see that this is the time point where the Ganjam district is seeing an increase in cases to 359. So it's in 25th May. So it's the mid of May where the number of migrants has already been reached in Odisha, and then the number of cases has also confirmed cases has also increased. So you can Ganjam has been followed by Jashpur, Baleshwar, Bhadrak, Khurda, Puri, Cuttack, and Kendrapara. All those have been there in the COVID portal. I collected those different point of time. Then if you look into 20th June, so again you can see that Ganjam is the one which are having highest number of positive cases. And again, if you have been looking into the 17th July, Ganjam is the one which is having too high than the Khurda. Okay, but looking to after that, okay, this is 13 August one. So the mid of May to the mid of August, Ganjam is the one which has been leading in terms of the positive cases. If you move to the 9th September one, you will find that it's the Khurda one. Khurda has been leading the leading the cases, confirmed cases, followed by Ganjam, Cuttack, and Raipur. Okay, then you will see that after the mid of August, it's showing that the Ganjam administration might be the Ganjam district administration has taken it very proactively, and then that's what it has also came into the different news. Also, international agency has cited the Ganjam's management on the COVID part. And then you can see the Ganjam again. It's the Khurda, then Cuttack, then Ganjam, then Puri, then Mayurbhanj. So you can again see the Ganjam one in the 19th of November, the recent one, is the Khurda, which are having around 51,000 cases, followed by Cuttack, then Ganjam, then Puri. Okay, so these are the situation of the different districts one. Okay, and my point is that basically the increase in the confirmed cases, which has started basically at a faster rate during the mid of May to maybe the August end. So it's because of the highest number of inflow of the migrant from different parts of India to Odisha. Okay. So if you we can see the number of confirmed cases, number of active cases, number of recovered cases, and you can judge that even the number of confirmed cases in Ganjam is higher, like 21,559, the number of active cases till now is very less. The number of active cases in Ganjam is 67. But if you look into say Anuppur, say Baleswar, even though the number of confirmed cases is half of Ganjam, these are the districts which are having very high active cases. Like Anuppur is having active cases till now is 386. Baleswar is having 287. This basically shows that certain districts they have been very proactively managed the COVID situations than the other districts. Okay. These are the districts we can look into from the COVID side. Then if we move to the age-wise and gender-wise COVID cases, we will find a picture of which is not there in the literature. That basically saying that the whatever literature you can say is telling that COVID will mostly affecting the children and the old people. Okay, but if you see the pictures here, it's telling that the number of around more than 50% cases is within the age group of 15 to 40. And it will include 15 to 60. So it's around 85% of the total confirmed cases is within 15 to 60. That means the children and then the age-old group, they have been affected less in Odisha. And if you look into the male-female distribution, you can see that around 67% of male have been affected by the COVID cases, and 33% is the female. So it basically shows that males are more vulnerable towards the COVID than the female. Okay, so this is basically shows that the physical infrastructure which has been created by the state government. Okay, the number of total tests which has been done by yesterday, it was 55 lakhs, out of which the number of positive cases, which is 5.68, only, which has also seen a decreasing trend, and the negative result is around 94%. Okay. So these are again the government has established different kinds of public-private partnership, different COVID hospital, again COVID care hospital, and also there are some for the migrants. The government also arranged certain temporary medical care units at the panchayat level. So you can see those kinds of preparation at the state level as well as at the district level. Okay, the number of beds, the number of medical care centers, COVID care centers, and COVID hospitals. So these are the figures of that. If we look into the number of migrants who has been traveling to the Odisha, we'll see that by the train route, around 4 lakh. These figures are up to 7 July. So after that, the government has not updated the figures. So by 7th July, this month, around 3.6 lakh migrants have been arrived at different places of Odisha. And out of that, you can see the destination is their origin basically. Means you can see that Gujarat is the one which has been contributing more number of migrants, followed by Telangana, then Tamil Nadu. These are the three different states which has contributed most of the migrant has been moving to those places. Then this is by air, and this is a published index. So this is the district-wise contributions, and then contribution of the district from different states. Like suppose say Ganjam has migrant from Tamil Nadu. So these are the Gujarat, the Maharashtra, Andhra Pradesh, and these are the things which has already been there in the COVID portal. These are the number of migrants who has been reached through the route. These are the figures of that. Okay, so then I will move to my second part. Second part is basically I'll just give you a few pictures of the employment trends in Odisha and then the poverty trends in Odisha, and then I'll try to link it to the migration pictures, though the migration figures and that figures are not there with me. Okay, so these are the figures which I have done several years back. This is the figures of 2011-12 National Sample Survey Organization figures. So these are the figures of different decile-wise income group, their employment, and then the overall employment in the different sectors, in the rural, urban, and as well as the rural. If you look into the employment scenario in case of Odisha, you will find that it's around 50% of the total population has been engaged in the primary sector. But if you look into again the rural one, it will be 57.48%, and urban it will be lower. And then secondary, the aggregate picture is around 22.57%. People have been engaged in secondary, and then around 28% of the people have been engaged in the tertiary sector. But if we look to the lower income group people, okay, so these are decile-wise classification, like lowest decile 10%, then the next 10%, next 10%. Okay, so if you look into the lowest income decile group, so those are the people who have basically have their employment from the primary sectors, and you will find that the highest income decile group, like suppose say the upper decile, the 10th decile, you will find that around 43, in the highest income decile, around 43% of the people in the rural area engaged in the tertiary sector. In the overall, you can say that around 50% of the people has been engaged in the tertiary sector from the highest income decile. So these are the income decile-wise classification. You can find that is the lowest decile which have engaged most the primary sector, and the highest income decile mostly engaged in the tertiary sector. It's kind of okay. Then if we move to the different occupational group classification, like NSSO has classified the employment into self-employment agriculture, self-employment non-agriculture, regular wage and salaried earning, agriculture labor, other labor, okay, who are basically the casual labor, and then the other groups. Again, the income decile-wise classification, you will find that the lowest decile group mostly engaged in either self-employment in agriculture or agriculture labor or other labor. So these are the activity which the lowest income group will do. And if you look into the highest income decile group, they are mostly engaged in the self-employment, non-agriculture, regular wage, salaried earning. You will find that this is for rural Odisha. So you will find that in rural Odisha, around 35% are engaged in the self-employment agriculture, 20% in self-employment non-agriculture, 7% on the regular wage and salaried earning, and agriculture labor is around 18%. Other labors are around 13.45%, and the others are basically 7.46%. And similar is the case in case of urban Odisha. You will find that income-wise, decile-wise classification of those occupational group, and you will find that the lowest decile has been basically engaged in the casual level and the other level, as well as the self-employment group activities. But it's the highest income decile who have been engaged in the regular wage earning group. The pandemic basically will affect mostly not the regular wage earning group because they are having a fixed earning, but it will affect mostly the self-employment who have been in agriculture and those self-employment who have been in non-agriculture, as well as it will affect the casual labor group. It will also affect the group which is the other group or other labor. So then if we move to the percent poor in Odisha by 2011-12, you can see that the rural Odisha around 36% of the people have been poor. In urban Odisha around 17%, 3% people have been poor, and in total around 33% of the people have been poor. These are the pictures of 2011, but the recent round which has not yet been published, 2017-18, specifically give you a drastic increase in the poverty again, okay, which has not been published by the government for that reason. So there are certain people who have done certain analysis on that, on the pirated one, okay, which basically tells that the monthly per capita consumer expenditure of the rural and urban India has been declining from 2011 to 2017-18. if there is a decline in income, of course the poverty will be, instead of declining, it will increase. So the poverty already has been rising before the COVID-1. So if this COVID situation, after the COVID situation, will be again having an drastic increase in the poverty, both in Odisha and as well as in case of India. So if you find that, then this is basically shows the picture of poverty in different parts of Odisha. You can see that the coastal part is having a low intensity of poverty, whereas the southern and northern part are having a higher intensity of poverty. You can also have a look into the percentage of the poor, like the total rural poor are 100, then how much each of the region has been contributing. Okay. So you can find that these are again the classification by social group and economic group. You will find that as the SC, ST, they have been more vulnerable towards the poverty, and it's the self-employed group, especially the agriculture group and the other group. These are the two groups who have been more vulnerable towards the poverty. That means the poverty account ratio for these two groups have been higher than the other groups. These are the pictures of urban Odisha. You can refer kind of the casual labor is the one, and the other is the one who are having more poverty than the other group, and SC, ST are having the more poverty than the other. These are the figures for 93, 94, 2004, 5, and 2011, 12. Then we can move to the plights of the migrant. Generally, to have in development economics different theories of migration, like starting from the Lewisian theory to Herod-Domar model. These are the theory which basically telling that there is a traditional sector, there is a modern sector, there is a movement of labor from one traditional sector to modern sector due to because the modern sector is having a higher wages. But this is not the case in case of Odisha. In case of Odisha, we will see that mostly you can divide the migration patterns into different kinds of regions. Like you will see that coastal regions are having a kind of migration which is temporary, even though temporary in nature. It's a kind of towards the hotel industry. You can find a large number of people in say Andhra Pradesh, even in West Bengal, in the hotel industries. From mostly Bhadra, Kendrapada and all. Then if you will see the KBK belt, you will find the KBK region, there are migration towards the clean industry, towards basically towards the disaster the industry which is kind of too much exploitative in nature. And if you can look into the migration patterns of say basically GANJAM, which is contributing around 5 lakh migrant, so you will find that it's mostly towards the Surat. So you can look into the different kinds of literature on migration and livelihood, but no such literature has yet been done on including the epidemic part into the migration and livelihood. So according to the National Commission of Enterprise of Unorganized Sector, so they have classified what is formal sector, what is informal sector, and around 92% of the total workforce has been engaged in the informal kind of activity. And these are the migrant, whoever has been, whether it's interested migrant, most of the migrants have been engaged in kind of informal activity or in the unorganized sector activity. And there is a tentative figures of around 20 lakh migrants has been there out of Odisha, and around 7 to 8 lakh who have been gathered already to Odisha after the post pandemic, because of the pandemic one. Okay. So if you look into the population census, so it's basically telling that out of 482 million workers, around 199 million are permanent workers and around 15 million are basically the seasonal workers. So these are the workers who have been mostly working in the different kinds of small sectors like garment industries, shoe industry, textile industries, and all. Okay. So if you look into the reverse kind of migration, the post-pandemic or the pandemic basically causes a kind of reverse migration. So if you look into the lockdown one, which has started in the 24th March, because of the lockdown one, all those the closure of the factory, there is no kind transport facilities and all. But this is during the lockdown only. So migrants have came to the road, to the stations, and okay. After the lockdown too, itself. So in order to manage such a huge influx of population, though the state government has adopted certain policies, like the Odisha government has requested to the other state to provide them shelter, to food, and the second lockdown itself. But the movement happens in the last end of the second lockdown and the third lockdown, when the third lockdown has already been started. You could see the government also has arranged different kinds of transport facilities, like different the buses and all. Also the train from Hyderabad and different Kerala from different parts of India. And then the government also has arranged the temporary medical center at the different the panchayat level. Okay. So these are the different kinds of steps which has already been taken by the Odisha government. But the major question which arises is whether how to provide all those huge migrant the food security, how to provide them income, how to provide them employment opportunity to such a huge populations. Okay. So these are the different states' responses which the government has announced. The central government has announced 1.70 lakh crores of package in the past when the first lockdown has happened, and then the successive announcement has happened on different packages, and the central government as well as the state government has announced the different packages for the migrants itself. Even the RBI has taken different kinds of monetary policy measures. So, okay, but the basic question again is how to provide these large migrants who have been more vulnerable income and employment one. So if we look into these are the steps which has taken by the Odisha government. Odisha government also tries to create 20 crores mandate in terms of the NOREGA programs. We also give assistance of 1,500 each individuals who have been moving from the other states, and then it has also announced a different package of 17,000 crore package for generation of employment and income generation. But all those are basically the short-term measures. But these are the people who needs a long-term income support and as well as long-term employment support. So what is the way forward then? The way forward basically is that in the short run, the government can lead the NOREGA program, the enrollment of the return migrant under the NOREGA program, and then identification of the potential skills of those migrants has to be taken. And then creation, though the government has announced, the Odisha government has announced 20 lakh mandates of employment per day, but it has been declared for the unskilled migrant. So no such attempt has been made for the semi-skilled and the skilled migrant. The state government will face basically two different kinds of problems. One is to contain the COVID-19 cases, which has arises basically due to the influx of these migrants, and then second is the providing employment to such a huge populations. Okay. It is required basically to design employment generation plans under the small scale industries which have all type demand, like different kinds of industries as food processing industries, stitching industries, like designing industries and all. And to manage the COVID-19 due to the huge influx of migrant, which has already been started, the public-private partnership in the health sector, and more spending, of course, more spending on the health sector one. And the most important thing is that the knowledge and skill required by the migrant as well as their work experience may be tapped and utilized for the entrepreneurship development in Odisha. Suppose say from Gujarat, those who have been mostly moving from Ganjam to the Gujarat, the textile industries or say the gold industries. These their skill has to be tapped, and then such kind of small scale sector has to be established in their localities. There is urgent need to create a database for the migrant worker at the panchayat level, and a system should be created for the registration of each of the migrant workers. And then the public distribution system has to be extended to this individual, even though they are not having any kind of Aadhaar card. It has been seen that the large number of migrants they don't have a Aadhaar card or they don't have a passport. They don't have any kind of identification. And identifying the potential employment generating sector, as it's already been talked by the resource person, Dr. Amarendra, on the effect on different sectors. Okay. So the government has to identify the potential sector. You might have had in macroeconomics actual output, potential output, actual employment, and then the potential employment. The government has to identify what are the sector which are having a high potential to absorb these kinds of labor. Might be those sectors which are having high employment elasticity. Those kinds of sector has to be identified, and then extending the NOREGA to for the migrants worker. So these might be these will be the different solutions for. At the last, the pandemic might be a global, but what we need mostly the local content should be needed, and basically decentralization efforts should be needed to deal with this food pandemic. Thank you all.
Thank you, Dr. Priyabrata Sahu. Presentation for the detailed presentation about the trend of COVID-19 cases and overall idea about the livelihood pattern of the people, the way COVID-19 affected the livelihood of migrant, informal sector workers, and the man or the states have been able to control the situation and for suggesting the different measures to provide livelihood to such vulnerable sections. Thanks for your effort put forward to make our webinar a beautiful or a successful one. Thank you. There are so many questions in the chat box, and I feel like we are too late right now to take the questions, and we may put these questions before the resource persons so that they can.
Thank you, Anita. Now I would like to request my erstwhile student, who is presently the director of IPREMS, Dr. Pradhan, to give a word of vote of thanks for this webinar. Dr. Padi.
Thank you, sir, for your support. On behalf of KSUB College, Kavi Samrat Upendra College, and Institute for Policy Research in Economics, Management, and Social Development, we are so much pleasure to see all the great stalwarts about the presentation. And first of all, we would like to thank Dr. Niranjan, Principal of KSUB College, for accepting our request in collaborating this webinar. And thank you, sir. Without your interest and enthusiasm and endeavor, we are not make possible about this webinar. And next, Dr. N.B.Pradhan sir, who is my hidden teacher and now is the HOD of KSUB College Department of Economics and IPSC Director of KSUB College. And without his interest we have not think for this webinar, and he has actively structured this webinar for the starting till this date. Thank you, sir, for your support. And this is the new beginning, sir. I don't know how much where we have Bandana College established any seminar or not. I don't have that of idea because I was a student of you and I was